Assalamualaikum and good day to everyone. Today I will presenting the pharmacodynamics and pharmacokinetics of morphine. My name is Daliza Esma binti Jawa, a Bachelor of Biomedical Science at University Selangor. Question. Objective: explain how morphine interacts with opioid receptors and neurotransmitters, show the relationship between the dose, effects, and risk, discuss how morphine affects behavior and its potential for addiction, and highlight how morphine can be used safely and effectively. Introduction: morphine is a strong opioid painkiller used for severe pain. It works by acting on the central nervous system to change how pain is felt. This presentation focuses on pharmacokinetics, how the body processes morphine, and pharmacodynamics, how morphine works in the body. Mechanism of action: how it works. Morphine attaches to receptors and acts like natural pain relieving substance called endorphins. After binding, it blocks the release of neurotransmitters like substance P and glutamate that send pain signals to the brain. Morphine also changes calcium and potassium channels, making it harder for neurons to pass on pain signals. Receptor function: morphine mainly works on three types of receptor: Mu for pain relief, euphoria, but also respiratory issues. Delta affects mood and emotions. Kappa helps with spinal pain but may cause unpleasant effects. Okay, the diagram. Here, how pharmacokinetics and pharmacodynamics interact. Pharmacokinetics refers to how a drug moves through the body, includes absorption, distribution, metabolism, and excretion. Morphine interacts with the body at each of these stages. Route of processes. Here the picture. Number one, absorption of morphine. Definition describes how the drug moves from the site of administration to the site of action. Depends on multiple factors such as drug food interaction, the formulation and chemical properties of the drug. Route of administration: from oral, morphine is absorbed in the gastrointestinal tract, and injection directly enters the bloodstream, example IV. Bioavailability: oral morphine has low bioavailability due to first pass metabolism in the liver. Distribution of morphine. Definition: distribution is the transport of morphine from the blood to tissues. Processed morphine binds to plasma proteins. It crosses the blood-brain barrier but less efficiently compared to synthetic opioids. Morphine acts on mu opioid receptors in the brain and spinal cord and indicates how widely morphine spread in the body tissues. Metabolism of morphine. Metabolism is how the body chemically modifies morphine, and primary site is liver, mainly in the liver, produce active and inactive metabolites. Morphine undergoes glucuronidation by the enzyme UGT2B7. It is converted into two main metabolites: active by M6G, contributes to pain relief, and inactive from M3G, may cause side effects. Impaired liver function can slow morphine metabolism, increasing toxicity risk. This is the clinical relevance. Okay, structure of morphine. And then number four is excretion of morphine. Excretion is the removal of morphine and its metabolites from the body. Primary route is renal excretion, kidney. Process: about 90% of morphine is excreted as metabolites in urine. A small amount is excreted unchanged. Clinical consideration: patients with kidney disease may accumulate toxic levels of metabolites like M6G. Okay. Factor affecting morphine pharmacokinetics. Age. Neonates and elderly have slower metabolism and excretion, liver and kidney function, drug interaction, and genetics. Pharmacodynamics refers to how a drug affects the body, includes the drug's mechanism of action, the receptors it interacts with, and its physiological effects. Understanding how it interacts with specific receptor in the brain and spinal cord to produce pain relief and other effects. Morphine works by binding to mu-opioid receptors, which are found mainly in the brain, spinal cord, and other parts of the body. Flowchart how morphine produce analgesia, and this is the picture. And then the table of comparing the therapeutic effect and side effect of morphine. When using morphine, we must consider several clinical factors to ensure safe and effective treatment. Clinical considerations in morphine use, dose depends effect. The effect of morphine are dose depend. At lower doses, morphine provides pain relief with minimal side effects. At the higher doses, sedation and respiratory depression become more pronounced. Individual variability. Different people may experience varying responses to morphine due to the factor like genetic and age. Summary. Pain relief. Morphine is an effective analgesic mainly through its action on mu-opioid receptors in the CNS. It induces calming effects and can cause feeling of euphoria. Respiratory depression, constipation, and nausea are more are common side effects, and long-term use can lead to tolerance and dependence. Thank you.